Hello everyone, I am Dr. Puja and I am a neurologist. So on this World Brain Tumor Day, I am here to talk about it. So as we all know that there is so much of fear and phobia that revolves around the term tumor, and I hope with this video we would be able to spread little bit of awareness related to it. So let's start. So what are the types of tumor? So basically it is of two types. One is primary brain tumor and the other is secondary brain tumor. Primary brain tumors are the one which are localized just to the brain, while secondary or metastatic brain tumor are the one which spreads from other part of the body into the brain. So this is the distinction between both these types of a brain tumor. So now coming on to which age groups get affected by brain tumor. So brain tumor can affect any age group starting from a baby high up in the elderly. And now coming on to the symptoms of brain tumor. So the common symptoms of brain tumor includes headache, vomiting, seizures or fits, and depending upon which particular part of the brain is involved by the tumor, these symptoms would vary. So patient can have difficulty in speaking, difficulty in walking, numbness in any half of the body or behavioral abnormality, etc. etc. Now coming on to some common risk factors of brain tumors, which include exposure to alcohol, exposure to smoking, exposure to herbicide, pesticides, or exposure to radio frequency, any history of head trauma or a family history. Now coming on to the diagnosis. How do we diagnose brain tumor? So for that, we run certain tests for the patient in the form of an MRI, CT scan, or we may require biopsy in some cases. And finally coming on to the treatment of brain tumor. So for the treatment, the most important part is the early detection, and for early detection, the most important part is the awareness. If people are aware about it, then only they can approach the neurologist for the diagnosis. And now coming on to the treatment part. So treatment part is basically divided into surgical or non-surgical, and in non-surgical we have chemotherapy, radiotherapy, etc. etc. So this is the discussion about brain tumor in a brief message, and I hope with this video we would be able to spread awareness. So just be aware and spread the awareness. Thank you so much for listening.